Pfizer and its partner BioNTech announced today that their COVID-19 vaccine is effective in young children. According to Pfizer, a dosage one-third the usual dosage for an adult spurs a development of antibodies in children 5 to 11 that are on par with those of vaccinated teens and young adults. According to Dr. Bill Gruber, Senior Vice President of Pfizer, the next step is for the children's dosage to apply for a full authorization from the FDA by the end of the month. 5 million children have tested positive for the virus and 460 have died since the beginning of the pandemic. Take Mississippi, for instance. According to the Mississippi Department of Health, 69 schools reported COVID outbreaks in August. More than 1,000 children and 300 teachers have tested positive for COVID. But COVID's reach in Mississippi spans far beyond the school system. The state has recorded the highest rate of COVID-related deaths per capita in the country. Nearly 1 in 320 people in Mississippi have died of COVID since the beginning of the pandemic, a rate that has a profound impact on black people. By the way, Mississippi is the blackest state in America. As of the beginning of September, black Mississippians account for 40% of the COVID deaths in the state, which is on par with the black population of the state, which is 38%. But where the alarming disproportionate impact creeps in is in things like 60% of the pregnant women who have died of COVID in Mississippi are black. Critics of Mississippi's handling of the COVID point to the fact that the state has the fewest active physicians per capita of any state, the closure of 5 hospitals in the past decade with 35 more hospitals at risk of closure, and the refusal of Republican leadership to embrace Medicaid expansion under the Affordable Care Act as contributing factors for Mississippi's struggle with the virus. Joining us to discuss is BNC Medical Correspondent Dr. Corey Hébert. All right, first, Dr. Hébert, let's start with the good news. Pfizer's vaccine proven to be effective in children 5 to 11. What do you make of that news?
Well, the first thing is that we know that Pfizer says it's proven, but the FDA has not said it's proven, and then the CDC has to check the FDA. So Pfizer has every reason to say that their vaccine is safe, and I think that it probably will be. But what we always have to remember, Charles, is the process. The process is what makes these things go smoothly and makes it so that people will trust the vaccine. So Pfizer can say whatever they want to say about their vaccine, but they have a reason to want it to be safe and effective. We have to look at all the data and look at it very closely, especially because it's for children, and make sure that every T was crossed and every I was dotted so that we don't have any backlash and these children can remain safe and protected. So we probably will have something at best in the next 3 weeks, at worst probably before Halloween, and I think it is going to get the emergency use authorization.
So let's talk about that process and that emergency use authorization. You know, Pfizer is saying they were able to apply for full authorization within the next month. But as you say, it has to go through at least 2 different agencies. Is that a realistic timeline?
It can be. I mean, because we have to pour over the data, ad nauseum to make sure that it's appropriate. And sometimes when they give the data, sometimes it's so clean that we can't help but just say, hey, this makes sense. Sometimes the data's raggedy and we have to kind of go through it, like with AstraZeneca. AstraZeneca has some raggedy data. That's why they don't have the approval right now. And that's why, as a principal investigator, I got to make sure my data is crystal clear and very clean, since I'm a black principal investigator, and then submit that. Then Pfizer goes through it, and then they give it to the FDA, and then the FDA goes through it. Then the CDC goes through it. That's why people say, oh, this is rushed and all that. Man, we've been looking at mRNA vaccines and doing experiments with mRNA vaccines since the early 90s. This is not anything new and exciting. What we need to make sure is that we vaccinate these children. That's what we need to do.
So let me ask you a question, because it just wasn't clear to me, and maybe you know the answer to this. They said that they were giving the children a 1/3 dose. But does that mean that they only got 1 shot, or did they get 2 shots at 1/3 of the dose?
No, they got a third of the dose each shot. So basically, it's 10 micrograms.
So they
Adults get 30 micrograms.
They didn't have to do 2 shots just like adults.
Oh yeah, they're gonna have to get 2. They're gonna have to get their Fauci ouchies just like everybody else. It's not a good thing, but they have to get them. And we making light of it because right now these children need to get protected because they're getting COVID. Now, as you mentioned, they've had less than 500 deaths from children throughout this whole thing, which is a very small amount. But still, one kid is too many when we can have a vaccine to prevent it.
So let's say that the FDA grants emergency approval or full approval, right?
Sure.
And the CDC goes along with a recommendation to have these children vaccinated. Do you believe that we should have school districts that mandate that all children in school be vaccinated?
Charles, I think that I will go one step further. I think everybody in America, I think we should have a universal mandate for everyone in America, unless you have a medical problem or you have some type of religious exemption. So if you're Buddhist and you don't want to do it, let me talk to your Buddhist monk so we can get that together. Or you have some type of personal exemption that is legitimate. I think everybody should have the vaccine, and we wouldn't be in this situation right now, including children. So, yeah, I think there should be a mandate.
Let's talk about what's happening in the Deep South, and because I want to talk about that because many of those states have incredibly large percentages of black people. Mississippi just hit this milestone today in number of deaths. It is the blackest state in America. And let's talk a little bit about how, black women who are giving birth already have disproportionately bad outcomes relative to white women. This number of 60% of the pregnant women who have died being black women in Mississippi, that's just an extraordinary number. What are you taking?
Yeah, it is, Charles. And let me explain it to you. We have an issue with the social determinants of health in this country. We have an issue with implicit bias. So we know that white people, white doctors, think black people, by and large, are less a human being. That's just, and that's what we have seen. It's not like I'm sitting here postulating and pontificating about something that we don't have the data to support. We have had study after study after study, especially women, black women of childbearing age. You have a better chance of having a baby that is healthy and you also being healthy in a developing country as a black woman than you do in America. That's just a fact. And so when you start looking at that, it's because of the social determinants of health. Where we live, where we love, where we work, where we play. If you live in a bad area where they don't have doctors and you have no prenatal care and you have no good food, you have no prenatal vitamins, then you are going to step into that hospital at a disadvantage. And then the white doctors and black doctors are also going to sometimes treat you poorly, and then you're going to have a bad outcome. It's just as simple as that.
Dr. Hébert, always a pleasure, sir. And I really love that Jolly Rancher colored bow tie you have on tonight. It's really great, snazzy. Thank you, sir.